The information and techniques presented on this DVD have a purely informative nature. Seeking the advice of a specialist and thoroughly following his or her advice is absolutely essential, and this DVD cannot substitute them. In the stage of menopause, there are two conditions occurring with some frequency: urinary incontinence and uterine prolapse, or the slipping down of the womb. In order to prevent or minimize the consequences of these conditions, it is necessary to strengthen the perineal muscle, beginning at 30 years of age. American gynecologist Arnold Cahill developed some exercises intended to relax and improve the elasticity of those muscles, which make up the floor of the pelvis. Basically, these exercises consist in the contraction of the pubococcygeus muscle, or perineum, which is equivalent to the contraction of the bladder when finishing urination. To achieve the strengthening and a greater elasticity of these muscles, practice on a daily basis the exercises we will be presenting next. Cahill's exercises can be carried out in any position, whether sitting or standing, watching television, while you're working, when you're waiting for the traffic lights to turn green, etc. There is a slow Cahill's exercise and there's a fast one. In Cahill's slow exercise, contract your perineum for 5 seconds. 1, 2, 3, 4, 5. Relax the muscle for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. For Cahill's fast exercise, contract your perineum for 2 seconds and then relax it as you count to 1. Repeat this exercise 10 times. 1, 2, 1. 1, 2, 1. 1, 2, 1. 1, 2, 1. 1, 2, 1. 1, 2, 1. 1, 2, 1. 1, 2, 1. 1, 2, 1. 1, 2, 1. The next exercise, conceived by Cahill, is carried out while you're lying on your back, having your legs slightly flexed or at a right angle leaning on a support. In the first stage, contract your external anal sphincter and push the muscles of the vagina forwards and upwards, as if you felt like urinating but were unable to. Keep contracting and pushing upwards until you experience the sensation of having something inside that is rising. Make this movement with moderate strength and maintain the contraction for about 2 seconds. Relax for 2 seconds and then contract again. Go on arrhythmically. You should concentrate on exercising the right muscles. Verify it every 2 days by interpreting the passing of urine. In the second stage, once you feel confident that you've found the right muscles, you can start contracting them more vigorously. Maintain the contraction with strength for 4 to 5 seconds and relax your muscles for 10 seconds. Repeat this process 30 times. If you already suffer from incontinence or are prone to perineal distension, do these exercises from 8 to 10 times a day. If you have undergone surgery for incontinence or suffer from distension, do the exercises 4 times a day, starting 4 weeks after the operation. If you just wish to prevent future troubles, repeat them twice a day. We are next introducing other exercises specifically aimed at urinary incontinence. During the carrying out of these exercises, it can be useful that you imagine that you have a clock on your abdomen, showing 12 on its top under your breastbone and 6 on your pubis. First exercise. Lie down, having your legs flexed and slightly apart. Stretch your arms on both sides of your body. Breathe normally and push your belly forwards and backwards, as if you wanted to mark 12 o'clock first. Then push as if you wanted to signal 6 o'clock. Second exercise. The position is the same for the first exercise. Breathe normally. Push your belly upwards, 12 o'clock, leftwards, 3 o'clock, downwards, 6 o'clock, and towards the right, 9 o'clock, and then go back to the initial position, 12 o'clock. The rotation ought to be slow and not too broad. Third exercise. Remain lying on your back, having your legs flexed, and place a cushion between your knees. The soles of your feet must be properly leaning on the floor, and your hands should be relaxed on your abdomen. When you breathe out the air, forcefully press the cushion between your knees for 6 seconds. 1, 2, 3, 4, 5, 6. After that, relax. Fourth exercise. To be carried out while lying on your back, having your legs flexed and slightly apart, the soles of your feet leaning on the floor, with relaxed shoulders and your hands on your abdomen. When you breathe out the air, contract the muscles of the perineum to the best of your ability, as if retaining urine, for 3 to 4 seconds. 1, 2, 3, 4. Then relax. Each of these last 4 exercises must be repeated 10 times. Doing these exercises, together with Cahill's results, is the most effective therapy to prevent or improve urinary incontinence and uterine prolapse.